kind of knee supports are best for hypermobility? There's a variety of supports, but the way we look at it here at Parr PT is you have to figure out which support is going to be good in what phase of your recovery. So I just wanted to show like 3 basic ones that are typically used off the shelf that you find on Amazon, find in the store. But the first one is we really want to consider what type of injury that you've had. You know, we've had people with, you know, whether it's really, really bad trauma, ACL tears, meniscus tears, MCL tears, like that typically after surgery and after rehab, depending on what you're doing, if you're still having issues, it does require more of that bulky one that basically you slide on, you Velcro, and sometimes they'll have the hinges like a harder support. That way it prevents you from hyperextending or maybe prevents your knee from going in and out. That's typically what we find with the more aggressive knee injuries or a knee trauma that you've had, that kind of support would fit you best. Okay, obviously the goal is to build enough stability to where you can taper down, but that's typically where you find those like hard metal bars, tight Velcro straps with a little cup for the knee. And then we have a version where maybe people with just chronic knee pain, not any serious trauma directly, no ACLs, no meniscus, just chronic pain in the knee, and you know, they can have it with, you know, steps and walking. A lot of times that's something called patellofemoral syndrome. So where that kneecap is not gliding where it needs to go, whether it's due to fascial restrictions, maybe it's a little bit of quadricep weakness or imbalance between the quads and the hams. There's a bunch of different things that it could be from, but the idea is a lot of times that big bulky brace that I explained before is going to be too much for that type of condition, because now it's going to limit movement and it's going to cause those muscles to get weaker, possibly get more fascial restrictions. So normally what you find with those cases, they have the sleeves. So there's some variations with the sleeves that you put on just like a sock, but I'll kind of use my towel as an example. You put it on, you slide it here, and there's a hole here where the knee is. And it essentially just adds some sort of compression. It keeps everything stable. It keeps the knee from gliding too far out to the side, too far in, or any other direction. So once you have that sleeve on, there's blue neoprene sleeves, times where it's very similar to the other brace I mentioned, where you have what you strap on, but there's no bars. That's another version. It's a little bit more advanced. But the sleeve basically provides enough compression. That compression allows that muscle to activate more just from that proprioceptive input. So it's a good thing to use if you're having more advanced patellofemoral issues temporarily until you get the right treatment, the right rehab. And then there's the versions where we use KT taping, or whatever sort of elastic taping that you use to keep the knee stable. So in this case, you may have intermittent chronic pain with the knee. It's typically, you find people are a little bit more active, or you can find these people who aren't as active, but still find ways like they have enough quad activation to activate it, but you don't want to limit too much with the sleeve by using the sleeve. So then we use a KT tape where basically we're taping around the kneecap to keep it stable, but it allows your muscle to maximize its firing without having too much compression with the neoprene sleeve and way too much stability with a brace that has the outward supports, the metal bars, and the hardcore straps. So most people, they have difficulty trying to figure out, okay, which one is best for me, explaining more so with traumatic injuries early on, maybe some acute or more advanced chronic patellofemoral syndrome, or just same thing, patellofemoral syndrome, but maybe a little bit more minor. You could use K-taping, but the idea in all three is, even if you have to go extreme in the beginning to really reduce the amount of pain, the idea is to get the right strengthening program, the right treatments, whether it's dry needling, fascial work, any sort of like hands-on techniques that you would need to do to gradually get that kneecap to start gliding correctly and reduce any restrictions around it that are causing swelling or edema, as a way for you to progress with keeping that knee stable. So when we look at it, the higher end with the bars, the second one is like a compression sleeve, and the third is KT taping. Ultimately, we want to be able to do without it. So those are typically the three most common knee supports that we use and why we would use them, and then being able to understand which category would I fit in, and then who would I need to see in order to get past that, you know, in regards to getting back down to where you don't actually have to use the sleeve anymore. So we'll be putting out more content with the knee, because I know that's something that people tend to get a little confused about where to really start. But understanding the types of supports and when to use them is really important. And I hope that helps. And if you have any more questions, let us know. We'll be happy to add more on to these videos specific to it.